Good evening, Ed, and thanks to you for tuning in. We start tonight with breaking news on Ebola. Just moments ago in a show of force from the White House, top officials charged with health and national security issues said they've made this a national priority.
As the president has said, we are not facing just a health crisis. We are facing a national security priority.
Since the outbreak began, the United States government has been engaged in preparation both at home and abroad.
Our healthcare infrastructure in the United States is well equipped to stop Ebola in its tracks.
Here's the latest. Right now, a crew is disinfecting the Dallas apartment where Ebola patient Thomas Eric Duncan was staying. It comes 5 days after he was hospitalized. Crews also wrapped up and taped the car used to transport Duncan to the hospital. The 4 members of his family quarantined at the apartment will soon be moved to an undisclosed location. Also today, spreading anxiety, 2 reports, one out of Washington, D.C., another from Atlanta, of patients being tested for Ebola.
The patient has been admitted to Howard University Hospital with Ebola-like symptoms. That is how it is being described. They also confirmed that this patient had traveled to Nigeria recently.
There is an Ebola concern at the Cobb County Jail.
It indicated during the check-in process that he had been traveling recently in Africa. He was also exhibiting at the time fever-like symptoms.
Initial tests on the Atlanta patient have come back negative, but a final test is still to come. And late today, new details about the American cameraman working for NBC News who contracted Ebola. He's heading to a medical center in Nebraska for care. He was working with NBC's Dr. Nancy Schneiderman, who today said the crew is taking precautions.
We shared a workspace, we shared vehicles, we shared equipment, but everyone here is hyper alert. We have not been in close proximity. No one shakes hands. There's no hugging. So I do believe that our team, while we are being hyper vigilant, we are at very, very, very low risk.
NBC's Charles Hadlock is live in Dallas. Also, there's Dr. Seema Yasmin, public health professor at UT Dallas and staff writer for the Dallas Morning News. Thank you both for joining me.
Good evening.
Charles, let me start with the apartment. What's the latest with that and with the family that's living there?
Well, this is where patient 0 lived for several days while he was in Dallas. The Ivy Apartments here in northwest and northeast Dallas. What is going on right now is the cleanup. A private company has been contracted, and they are in the process of disinfecting and cleaning and removing the sheets, the beds, the carpeting, the other items that this man may have come in contact with. They're going to haul it away in 9 to 12 barrels. They'll be taken to a disposal site, held for a few days until the permits are right, and probably incinerated after that. The family is reportedly still inside the apartment. At least that is the official word from the city of Dallas. They are expected to be moved later to an undisclosed location, not a medical location, but simply another place to stay for another 20 days until the end of their incubation period to make sure they are not infected with the Ebola virus that they may have come in contact with while the patient 0 was staying here, Reverend Al.
Now, Dr. Yasmin, the hospital has now admitted it dropped the ball when Thomas Duncan first told a nurse, but not a doctor, told a nurse that he had been in Liberia. Quote, "We have identified a flaw in the way the physician and nursing portions of our electronic health records interacted in this specific case. As designed, the travel history would not automatically appear in the physician's standard workflow." Now, does this go back to basic questions of readiness at other hospitals across the country, Doc?
It really does, Reverend. And what we're hearing from the hospital is that there are 2 separate workflows. So the nurse had this crucial piece of information. She put it into a nurse's workflow, and they tell us that the physician's workflow is separate. What we want to know, though, is did that physician take a travel history? It's really incumbent, Reverend, on every healthcare provider to ask that question repeatedly. If a patient has those symptoms, CDC guidelines say you have to ask about a travel history. We have, though, heard from other local hospitals that since August 4th, they have been asking these questions routinely of all of their patients. In fact, they've built them into automatic electronic records so that nurses, doctors, all healthcare professionals ask patients about travel to West Africa.
Dr. Yasmin, let's talk about the timeline here. Thomas Duncan first went to the hospital on September 25th, but crews are only disinfecting his apartment today. So for parts of 9 days, the apartment could have been cleaned and wasn't. Should this have been done faster? And is there a threat that the virus could have spread from the apartment in that time?
Reverend, reporters at Dallas Morning News are talking about this right now. We're writing about this right now, about fundamental potential flaws in this investigation and the potential that CDC guidelines about cleaning that apartment were not followed. As you mentioned, hazmat crews went in today. We are asking that question about why were they not sent in earlier, and why were there potential soiled clothing and bedding remaining in that apartment for so long while that family was still in there?
Charles, isn't there been a lot of skepticism about how this whole thing was handled?
A lot of people want to know why it did take so long. I mean, they knew that the Ebola patient was here on Sunday, and here it is Friday afternoon. They're finally cleaning up the apartment. The reason they say they are moving the family is not for their health, because they are not symptomatic, but simply to ease the fears of the community here. They had no idea that an Ebola patient was living among them here for a few days.
Now, Charles, you know, Ebola is contracted through direct contact, but the director of the CDC says that includes being near someone who sneezes. Listen to this.
So there are certainly theoretical situations where someone sneezes, and if you then were sneezed on and then touched your eye or mouth or nose with the part of your body that was sneezed on, it would not be impossible that you could get spread in that way. And that's why, if you look at our guidelines, we say prolonged exposure within 1 meter or 3 feet is considered contact.
Charles, 3 feet is considered contact?
That's right. If you come in contact with any bodily fluid, of course, if someone sneezes, you're within range of being in contact. But also, this man was ill. He had diarrhea. He was throwing up. He was sweating. All those fluids are in that apartment. So the question is, were the people, the 5 family members, exposed to that during the time he was in the apartment, and also during the 5 days they waited until the cleanup crews arrived today? Those are very good questions to ask.
Yasmin, 5 days, 9 days later, we're told now that 3 feet is contact. Sneezing could expose you to it. It's a little different picture than it was originally painted to the American public.
Absolutely, and some of this public health messaging, sadly, is becoming confusing for our readers and for the public in general. We know from experience that Ebola is transmitted through that direct contact with infected bodily fluids, things like infected blood, urine, feces, and vomit. However, we do know that although there can be virus in saliva, there's always usually more virus, a lot more virus, in fact, in blood and feces in particular. But we have to be consistent about some of these messages. Our readers are becoming quite concerned about how exactly can we catch Ebola, and we are saying that so far the evidence says Ebola is not transmitted through the air, not transmitted through water or through food. That's what we're learning from CDC.
Let me ask you, Dr. Yasmin, just bottom line, is the United States ready to handle this Ebola situation as people are coming here or people are discovered already here that may have the virus?
Well, we really hope so, Reverend. We have a robust public health system here in the United States. We're hearing from cities and counties across the country that they are now really gearing up. They are ready in case an Ebola patient walks into the hospital. I was in a local ED yesterday and they said, you know what, we're on high alert. We know an Ebola patient could walk through the doors. So we're hoping that every hospital is taking that approach and that they're all gearing up in case there's another case of Ebola.
NBC's Charles Hadlock and Dr. Seema Yasmin, thank you both for your time tonight.
Sure.
Thank you.
Coming up, the story that Republicans don't want the president to talk about. It's a huge issue, and it could prove the difference in these midterm elections. Plus a stunning new failure by the Secret Service. How did a man posing as a congressman get backstage at a presidential speech? Also, a Fox News anchor is now asking if being a grandmother might hurt Hillary Clinton politically. And tonight, Muhammad Ali, as you've never heard him before. Home recordings he made for his children. And two of the champ's daughters are here. Stay with us.